My name is Elidio Gomez. I'm 36 years old. I tested positive for COVID-19 and was hospitalized at Salinas Valley Memorial Hospital. My chest was hurting a lot. I was getting very fatigued. My bedroom is on the second floor, and it was getting very difficult for me to go up the stairs. I got in my car and took off. I arrived at the ER, where the tents are located, and they immediately had me go in. They took one look at me and told me to follow the lady. She already had with her a wheelchair. I didn't even have a chance to park my car. It stayed where I left it.
Mr. Gomez was critically ill. He was breathing 40 to 50 times per minute and was having trouble catching his breath. The normal amount of times that we breathe per minute is 10 to 20. As we watched him in the emergency department, he wasn't able to keep up. It was essentially he was running a marathon for hours on end, and he just couldn't keep up. So he was getting more fatigued. And when that happens, someone can have a cardiac arrest, or we have to emergently place them on the ventilator. We spoke with him and recommended that we place him on the ventilator. And so it was done in a very controlled setting, safely, with our full staff around. He had a fever for quite a long time. With the coronavirus, we think that the patient has what we call viremia. So they have a high number of replications, or the virus is actively making more virus in the body, causing a lot of inflammation. And then you develop this very brisk inflammatory response. And that's what affects all of the organs.
I remember opening my eyes and was asked if I knew how long I had been there, how long I had been hospitalized. And I said, I think it's been 2 days or since yesterday. And they said, no, it's been over 15 days. I didn't remember that. A nurse named Rosie would tell me, you'll be fine, you're young, you're strong, you'll be fine. I would look around, unable to move. I was in bad shape. I thought I was going to die. I couldn't depend on myself. I couldn't move my feet. I remember they had to give me water to drink out of a spoon because I could not grab hold, and I couldn't drink directly.
He wanted to start eating, but he was so weak that we had to have our speech therapist work with him so that then he could swallow safely. And then we get our physical therapists and occupational therapists who go into the room and start just moving his legs, moving his toes, moving his arms, and then start to be able to feed himself again. Bring a cup to his mouth, which is something that we all take for granted. What I've seen from COVID-19 is that this is a devastating illness. It kills people, tears families apart.
To the doctors and nurses who took care of me, they say God acts and manifests himself in many ways. I saw him there. I felt him there. In the way they took care of me, the way they worried about me. To all of you, thank you.
Muchas gracias.